Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to go over stiff walking after knee replacement surgery and what are my top recommendations and exercises to help overcome this and get back to walking normal and feeling better. Before I jump into that, be sure to hit the subscribe button, turn on the notifications so you can catch all of our videos related to knee replacement surgery. So really fast before I go into the exercises, I have 4 really quick important things to keep in mind if you're having stiff walking after surgery. Thing number 1 is keep doing your regular knee replacement exercises. So keep working on your range of motion, keep working on your strength. Those are really important. As those improve, your walking will subsequently improve as well. Thing number 2 is don't be afraid to use your assistive device, your walker, cane, crutches, for a little bit longer than you might want to early on after surgery. The reason for this, it's going to take some of that pressure off your knee and your legs, going to help with the pain management, and it's going to help you practice walking with a more normal, natural walking pattern with your feet and legs that will carry over to then when you're ready to transition away from that assistive device. So don't be afraid to use that assistive device. So we don't want to use it forever. We want to get wean off of it, especially if you weren't using one before surgery. But again, don't be afraid to use that early on to help with your walking and practicing walking. Thing number 3, stay on top of your pain. Tremendously important, especially early on, those first weeks after surgery, but continuing through your rehab and recovery. Pain medicine, taking it before therapy or before exercising, as well as when the surgeon and your therapist recommends and tells you to. Other secondary methods of pain management, icing, heat, whatever works most appropriately and best for you and that conversation you've had with your surgeon and your therapist. And thing number 4 is practice, practice, practice. It's going to take a lot of practice. Just like if you want to get really good at shooting a basketball, you have to take a lot of shots, shoot a lot of baskets. Same thing if you want to get better at walking and improve your tolerance and decrease your discomfort with walking. You want to do lots and lots of walking. Doesn't have to be very far, doesn't have to be very intense, but lots and lots of bouts of practice day after day is how you're going to get back to walking better and feeling less stiffness as you're walking. So let's go ahead, let's jump into those exercises. So really good thing to do at home is have a stable surface that you can hold on to for stability. We don't want anyone losing their balance as they do these. A kitchen sink, kitchen counter is my favorite option. I'm just showing you with the back of a chair here just for the purposes of this video. So as you're doing this, the first thing I like to do with folks is just get your feet side by side and we're just going to practice weight shifting. So just get comfortable putting weight onto one leg, shifting it onto the other. Getting comfortable getting weight through that surgical side as well as shifting off of it. So we'll do some weight shifting side to side, about a minute, 45 seconds. Then we're going to switch over. We're just going to do some weight shifts forward and backward. This is going to be a little bit smaller motion. You don't want to come too far back and lose your balance. But just again, getting comfortable putting weight on different parts of your foot and your base of support. So going onto the balls of your feet, back onto your heels. Shifting your weight, rocking back and forth. Then I want to have 1 foot forward, 1 foot backward. So now we're staggering our feet. So now a little bit more like what we would look like in a normal walking pattern. And now we're going to do that weight shifting in a diagonal. And what you can incorporate is that arm swing, just as if you were walking, but you're just rocking back and forward in place. You can lift your heel and lift your toe as you go back and forth. That's okay, but we're not moving our feet any more than that. Be sure to switch sides. For all these exercises, we want to do both sides. When we're walking and moving, we use both sides, so we want to do that with our exercises as well. Make sure both of them are working well for us. So that's the weight shifts. So then once we're comfortable shifting our weight, putting our weight on one leg and the other, going back and forth, then I start to go into some stepping patterns. So the easiest one to start with is some forward steps in place. So I just like to alternate forward and back, forward and back. Of course, if you need that stability, again, hold on to that kitchen counter if you need to, or whatever it is that you have available. That's perfectly okay. And just get comfortable taking steps in place. And then from there, we can also do backward steps. Doing about 10 or 15 for each leg. And then what I like to do is actually combine those. So do a big forward step, a big backward step. Big forward step, big backward step. This is working on your balance, your muscle strength, and your power as you're moving and stepping. It's working on your stability, working on your range of motion secondarily as your knee goes through the different motions of bending and straightening that are similar to walking. So it challenges a lot of different things. Again, doing about 10 or 15 to each side. And then I also like to do just some lateral steps out to one side and then the other. You also can get out in a hallway or an open area and just do side steps down the hall. Do about 10-15 feet one way, stop, do about 10-15 feet the other way. Again, building strength, stability, getting comfortable shifting your weight from leg to leg. I also like to have people do some backward walking. If you're a little unsteady to start, do it standing next to a wall or a railing if you need to grab on for support. There's also a couple exercises I like to do that are more focused on strength and power. So one is supported squats or body weight squats. Now if you're not feeling comfortable with body weight squats, you can just start with sit to stands from a chair, trying if you can not to hold on as you do them. If you need to initially, that's okay. Doing maybe 2 sets of 10 reps. Or we could do supported squats, so holding on at that kitchen sink and just squatting down and coming back up. Something that we tend to lose faster even than muscle strength is our power. And power is important because that gives us a good amplitude and good speed as we're walking, good functional speed and amplitude. So a lot of these exercises, doing it at a good healthy pace, not rushing necessarily, but not going super slow, is going to help us build back that power after surgery. We can also do some heel raises, going up and down on our toes, working our calf muscles. Very important with walking and being able to walk with good amplitude and speed. And I also like to stagger our feet and just in place here, doing some lunges up and down. Early on after surgery, you don't have to go too far. Just start getting comfortable doing this motion. And as you get comfortable and as you build strength and range of motion, go a little bit further and back up. A little bit further and back up. And start to build up your comfort and strength with that. Again, making sure we're doing both sides with all of these. And then some things I also just like to incorporate are some leg swings. So doing hip abduction out to the side, 10-15 repetitions, making sure to do both legs. You can also do some hip extension, leg swing straight backward for hip extension. And then also doing some knee flexion or hamstring curls in standing for 10-15 repetitions. This will get more and more tolerable as you build up that range of motion and strength in your knee. Again, after doing all those exercises, those are going to challenge you and challenge your knee and your strength, probably more so than anything would with just regular walking. So we're kind of exceeding the limitations and exceeding the needs and the stresses that are normal and needed for walking, because if you can accomplish those with the exercises, then walking should become easier over time. 3 main things to wrap up here that are the 3 main cues that I give anyone who is working on their walking and trying to walk better. 1, stand up tall, have nice, good upright posture especially those folks with their walkers or assistive canes. We don't want to be slouching down. We don't want to have that thoracic kyphosis. We're going to be standing up nice and tall. Thing number 2 is take big, healthy steps. We want to have large, big movements. We tend to diminish in our movements if we're feeling pain, if we're feeling unsteady. Our movements tend to diminish. And thing number 3 is I want you to walk at a nice, brisk pace. We don't have to rush. We don't have to speed. We don't want you to be unsafe, but let's walk at a nice, brisk pace, and that is going to kind of subconsciously, between those 3 things, thinking of standing up tall, big, healthy, full amplitude steps, and nice brisk pace, that is subconsciously going to start to improve your walking pattern. You're going to walk, your steps are going to be bigger, you're going to have that heel touch as you touch down, and you're going to be standing up nice and tall. So think of those 3 cues, check out those exercises. Be sure if you have any questions or comments below, leave them for me. I'll be sure to get back to you. Please hit that like button if you found this video helpful. Thank you very much for watching.